Hi there, my name is Edward David. I've been asked by Dr. Swales to give a short presentation on graduating Oxford early and starting work as an interim F1 during the COVID-19 pandemic. So just by way of background, I arrived at Oxford in September 2014 and graduated, I think in the end, about March or April 2020. We did our finals in February of that year, which I understand is no longer the sort of time point that they're done. And they were the sort of traditional exams, so they were short answer written format as well as their MCQ. And after doing them and being signed off, if you like, I went to Switzerland to do my medical elective for a disappointingly short period of time. I think it was about 3 weeks in total. And I remember sort of starting work and everyone saying, "Oh, this would just be a virus that would go away," and it was all sort of overblown, and that was including from some medical professionals. And then we had a series of emails from the medical school of graduating concerns saying, "Okay, well, we advise you to come back now," and another follow-up email, "We advise you to come back very strongly," and then finally one saying, you must come back now. And it's funny because I'd actually driven my car to Switzerland, which is where I was doing my elective, and Macron closed the borders sort of overnight, and it wasn't possible to get a ferry home. So I took a flight back, and my car actually stayed in Switzerland for some months thereafter. And then on returning to the UK, there was a real concern at the time about junior doctor staffing levels and what happened if a significant portion of the workforce went off unwell because they themselves contracted COVID. And so I think NHS England and the Trust in Oxford were trying to increase capacity, which meant they were looking to graduate us early, or at least get us to start work early. So we were basically given the option of either becoming an interim F1 in our like home trust, so in Oxford where I was at university, or basically where we were going to start foundation training. I chose to stay in Oxford just because, well, it's a great city, but also I had a rental property there at the time, and my friends were all there, and I think we all hoped that there might be a normal summer in Oxford to return to after some months. Obviously, that didn't transpire to be the case. And yeah, there were a series of emails that sort of came out sporadically from the medical school and offering sort of different postings, and I replied very promptly to one in the Northfield Orthopaedic Centre, which was aligned to sort of my interest at the time in medicine. And me and 3 or 4 others basically got posted there. And looking back now, it was actually like a very, very positive experience. I think because patients stopped coming to hospitals, and perhaps more elective procedures in tertiary centres and more specialised settings like the NOC were sort of deprioritised. There were actually a lot of junior doctors sat around is probably the wrong term, but waiting for things to escalate. And so we were very well supported, and there were lots of colleagues around, and that meant we actually had the space to learn over perhaps a longer period of time than most people get when they start F1 and F2. And I think the benefit of that was, I just felt very, very prepared when I did actually start, quote unquote, the proper thing. And yeah, looking back, it was actually a highly, highly enjoyable experience. And I think it set me up very well for the rest of foundation training. It was quite nice, actually, several sort of months later, or I think sometime into me having done F1, we received a letter from one of the senior people at the trust, basically thanking us for sort of graduating early and coming to help, basically. And yeah, I think it's been a strange sort of couple of years. I think, I wouldn't say necessarily that time was my worst experience of working in a sort of COVID setting. I think actually, approximately a year and a half later, when we came out of lockdown over the sort of Christmas period, and there was a sort of rebound effect. I think that was a particularly bleak period where lots of elderly individuals were sort of coming into hospital, and they're they weren't for escalation of treatment, and their relatives weren't able to come and see them, and quite a number of us were sort of doing like care of the elderly ward rounds, and having patients die on those ward rounds, and then having to spend the afternoon sort of calling family members and loved ones. I think that was potentially more challenging than my time at the knock, but I think that grounding and that support in a really good environment from some experienced F1s and F2s, and some experience of COVID even then, really put me in good stead. So wholly positive experience, and I won't wish for one anymore, but I wish you a very good rest of your conference.